Good afternoon, Miss. I am Jaryn Lopez and I'm going to perform Leopold's maneuver. Leopold's maneuver are a systematic method of observation and palpation to determine fetal position, presentation lie, and attitude. The purpose of Leopold's maneuver is to determine fetal presentation and position and the expected location of the point of maximal intensity of fetal heart rate and the woman's abdomen. And the indication of Leopold's maneuver is it is preferably performed after 24 weeks gestation when fetal outline can be palpated. And the contraindication, a full bladder may obscure the findings. And the special considerations are consider obese clients have thick belly fat which can also obscure the findings. Patients who are polyhydramnios may give an examiner a little difficulty. However, reassessment and rechecking of another nurse and intravaginal examination can help to confirm the findings.
Wash hands deters the spread of microorganisms. Explain the procedure to the patient. Explanation reduces anxiety and enhances cooperation. Instruct the patient to empty her bladder. This will promote comfort and allows for more productive palpation because the fetal contour will not be obscured by a distended bladder. Position the woman supine with knees slightly flexed. Place a small pillow or rolled towel under one side. Flexing the knees relaxes the abdominal muscles. Using a pillow towel tells off the uterus of the vena cava, thus preventing supine hypotension syndrome. Drape the patient to maintain privacy. Warm hands first by rubbing them together before placing the over woman's abdomen. Warm hands provide more comfort for the patient. Cold hands may stimulate uterine contractions. Observe the woman's abdomen for longest diameter and where fetal movement is apparent. The longest diameter is the length of the fetus. The location of the activity most likely reflects the position of the feet. Perform the first maneuver. Stand at the front of the client, facing the client using both hands. Feel for the fetal part lying in the fundus. Proper positioning of the hands ensures accurate findings. Palpate the superior surface of the fundus. Determine the consistency, shape, and mobility. Determine what position of the fetus lies in the fundus. Head feels round and hard, freely movable and palatable. Breech feel large, modular, and softer. Perform the second maneuver. Face the client and place the palms of the hands on both sides of the abdomen. Palpate the sides of the uterus. Proper positioning of hands ensure accurate findings, and this is to determine which direction the fetal head is facing. If one hand feels is a smooth, hard, long, continuous structure, it is the back. If the other hand feels the nodule angulation, it is the extremities of the feet. Perform the third maneuver. Gently grasp the lower portion of the abdomen, chest above the symphysis pubis, between the thumb and index finger, and try to press the thumb and your index finger together. Determines the presenting part of its mobility. If the presenting part moves upwards so an examiner hands can be pressed together, the presenting part engages. Perform the fourth maneuver. The nurse faces the feet of the client. Place one hand each on other side, lower pole of the uterus. Palpate the fetal head, pressing down about 2 inches above the inguinal ligament, and use both hands. This maneuver determines fetal attitude and degree of fetal extension into the pelvis. This should be done only if fetus in a cephalic position. Place your client in a comfortable position to ensure safety and comfort of the client. Document procedure and assessment findings and the client's response to the procedure. Documentation serves as a means of communication and basis of care and evaluation of patient's outcome. Wash your hands to deter the spread of microorganisms.